All right, so chapter 10 looks at leadership and administration. We're going to talk about some organizational ethics here in this last section of our class. So, physical therapists and PTAs shall promote organizational behaviors and business practices that benefit patients or clients and society. Now, what happens, let's just say you get promoted, all right? What if you want to be a manager? Can a PTA be the boss? How would that look? Consider different things you've experienced in the clinic. You have to look at what's the hierarchy of the organization. What are the responsibilities of the manager? Is there an administrator? Is there a leader? Okay, so yes, a PTA can be the boss. Some tasks of a leader are to envision goals, to affirm values, to be motivating, obviously managing a crew, achieving a workable level of unity within groups, explaining, serving as a symbol, representing the group externally to other groups, and renewing organizations. Overall, the focus of these tasks of a leader is to ensure that the leader promotes an ethical climate in an organization. Hopefully you have an idea now that you've come through the majority of class on what it looks like to be an ethical provider and take that into your organization, okay, to promote an ethical climate. So here are some traits of an ethical organization that we'll break down. Moral responsibility, trust and trustworthiness, effective conflict resolution, and peacemaking. This is a quote from Ruth Portillo that's in your text. She's a well-known physical therapy author and ethicist. Each member of the APTA must assume a central role in advancing the moral life of the profession. Each member must nourish a seed of self-governance, assume ultimate responsibility for his or her own actions, and be sensitive and responsive in his or her care. So she's talking about APTA members, and I would just challenge you, if you haven't become a member yet, please do so while your student rate is still in effect. And even more than that, every practitioner, I think, should hold to what she's saying in this quote, regardless of whether or not you're a member of the APTA or not, which I hope you would all choose to do. So an ethical climate means, first up, moral responsibility means that there is in the organization, an ethical organization, to facilitate an ethical climate. The moral responsibility is that there's exposure to ethical documents like the standards of ethical conduct that we're looking at all quarter, okay? And that there's open discussions of these values, okay? Trust and trustworthiness means that professionals are invited and encouraged to support the organization, and that there's review or rewriting of policies and procedures when issues are made known, okay? An effective conflict resolution hopefully is done early, and there's trust and respect on both sides of the dilemma, okay? So managerial aspects of ethical organization, we're going to look at patient-related duties, personnel duties, worker safety, and organizational duties, okay? So basically, looking about how does a business run and what considerations should we be aware of if we are the manager, all right? Patient-related duties, first up, we're talking about productivity, how efficient the staff is, how effective the staff is, how competent the staff is, and is there a fair allocation of all the assets of the profession being given out to each person who we come in contact with, okay? So productivity is a hot one, right? What does productivity even mean, right? So how many hours you work versus how many hours you're actually billing for, okay? Most places have a productivity standard that you have to meet. I know it is the cause for some burnout, okay? trying to always feel like you're having to just crunch the numbers and make money and not being able to connect with patients potentially, okay? Some patient-related duties, here are some examples, that there's documents posted for the patients to be able to see, first up, that their organization has policies and procedures. They also want to have like some patients' rights and responsibilities clearly posted. The organization also should have documents like mission statements or a vision statement. So a mission statement guides the organization's ideals and aspirations. And the vision statements is like a statement that may define the mission statement more clearly, or incorporate a larger organizational mission. Here's an example of a mission statement and vision statement from Children's Hospital. And you've probably seen these posted around in your clinics here and there. Hopefully you've seen them. I don't think any of our clinical sites are unethical. If you are seeing something that's otherwise as you're out there, please let us know. Please let maybe Jill even know, since she's clinical coordinator, yes. So policies and procedures consist of internal policies. So these are specific guidelines of actions or behaviors, like the rules of the organizations. Here's some examples. Like an ethical organization might have rules regarding orientation or training, might have different rules about how patients are put in isolation if they're sick, might have rules about use of equipment like a mechanical lift, okay? May have rules about your license being posted. I actually believe that's an RCW, that it has to be posted clearly, okay? And that you cannot work if the license is not current, okay? And external policies is another type of policy and procedure that an ethical organization adheres to. So external policies like MSDS, a material safety data sheet. This is mandated by federal law. You actually have to have clearly available all of the information about any chemicals that you use in your clinic, okay? So we even broke that down in my outpatient clinic that I worked at forever ago, or for years. We even broke down the Clorox wipes that we use to wipe down equipment with had to be included in the MSDS folder that we had, okay? JCAHO is another example of an external policy. This is the Joint Commission on Accreditation of Healthcare Organizations. So ethical organization is holding to JCAHO's mission and position statement. The mission of JCAHO is to continuously improve the safety and quality of care provided to the public through the provision of healthcare accreditation and related services that support performance improvement in healthcare organizations. Their position statement is helping healthcare organizations help patients. Now, patients' rights and responsibilities, these are associated to the healthcare organization's mission statement and vision. They provide guidelines and expectations, or patients' rights and responsibilities document would provide guidelines and expectations that patients and families may have of the organization. Also will provide guidelines and expectations that healthcare providers may have of patients and families. So again, you've probably seen these hanging out on the wall somewhere in your clinic. So take a look next time you're in there, maybe a little closer at them, so you can see hopefully these 3 bullet points represented. Personnel duties of a manager, so making sure that personnel have equitable working situations, making sure that there's clear job descriptions, and little things like when you're hiring, maybe just go ahead and do that background check, right? Managers also have to consider what their staff expects from them. So staff can expect cooperative support of management, can expect confidentiality. Staff can expect to utilize employee assistance programs, maybe like continuing education could even fall into this category, okay? Also, you can expect, hopefully in an ethical organization with a good manager, you're having regular team or staff meetings. Expect to have some debriefing times after treating fairly stressful patients, and you can expect to have a fair workload. Okay. Peer evaluations are one thing that an ethical organization and a good manager will want to utilize. So peer evaluations are a means of maintaining high standards of professional practice. They can be a tool to maintain a record of personal achievement. And there's different methods utilized in different organizations. What we used to use is a quick 4 or 5 questions, filling out on our coworkers. Okay, I put some examples up there of different methods used by different organizations. Worker safety is an expectation of any workplace, but we want to maintain a safe workplace, right? So OSHA. Workers can file a complaint with OSHA and employers cannot retaliate. So if you believe that a site is unsafe, you can definitely file a complaint. Employers cannot retaliate. If workers believe that a site is unsafe, like serious injury or death, you can refuse to work and employers cannot retaliate either. So what do you think might be some greatest risks in to PTs or PTAs in a workplace environment? You know, we're not working with like meat slicers or, you know, big booms or construction equipment or anything like that, right? But what about if you're working in a pool? Okay, what about if you are working regularly around mechanical Hoyer lifts, that kind of thing? So, and external policies are, so OSHA would be an example of an external policy. Okay, here's the mission statement for OSHA stands for Occupational Safety and Health Acts. Okay, another example of an external policy would be like bloodborne pathogen standards, okay, and safe lifting practices, okay. Organizational duties include risk management, fair allocation of resources, maintaining teamwork, and then upper management duties can be slightly different, okay. So manager has the expectation, or to be a manager comes with the following expectations: honesty, confidentiality, to take action with compassion, to have respect for the dignity of patients and colleagues, and also to carry your fair load as a manager. Okay. Risk management, following policies for safety, equipment maintenance, timely response to a patient quote-unquote event, filling out incident reports, getting informed consent, and appropriate supervision. All of those things are can be utilized to help minimize risk. Okay, fair allocations, contributions to continuing education funds, resource equity, and also that you have adequate items to do the treatments you need to do in physical therapy. Okay. Maintaining teamwork, we want to promote and ensure teamwork. We want to weave practitioners always into patient care, okay, and being engaged. All parties are needing to be engaged, especially when group work is needed. All right, so last but not least, upper management duties. Like I said, can be a little bit different here. So if you go into upper management, this is where there's a CEO responsible to a board of trustees. Then we definitely are going to have communication with JCAHO and other accrediting bodies, be in compliance with city, county, and state laws, and to develop strategic plans for the future. Okay. All right, that is it for now. You guys can read through the rest of Chapter 10 on your own.